So an important subject that's often discussed is the subject of palliative care. And the beginning of palliative care, to understand what it is and where it's appropriate, is to understand that palliative care is not the central focus of medicine, right? And it's not irreconcilable with the central purpose of medicine. The central purpose of medicine is to heal the patient. It's to restore health. Palliative care begins with the presumption that in many cases, not in many cases, but in some cases, that's not possible. And so the goal then in palliative care is to relieve pain and suffering. Now, in principle, you can administer palliative care as part of medical treatment. In other words, you can seek to cure the patient and relieve pain and suffering together. But when it's no longer possible to heal the patient, it's just about providing comfort to the patient. We refer to that as palliative care. Hospice would be a specific branch of palliative care. And the question is, how do we understand palliative care as a Catholic in light of the natural moral law? Provided that palliative care respects the fundamental orientation of medicine towards healing the patient, provided that it does not, euthanize people, lead to assisted suicide, that it doesn't deprive them of ordinary care, food and water, provided that, in other words, it respects the nature of the human person, it can be appropriate and it's needed and it can be helpful.